The topic for today is time health, times health, and then sustainable development goals. So, ensuring healthy lives and promoting well-being for all the ages across the world is the United Nations Sustainability Development Goal 3. They have given SDG 3 highest importance. That's what the United Nations has kept the goal at that level. So the SDGs are focused at ending the epidemics, also or preventing the epidemics, ending AIDS, tuberculosis, malaria, and many other communicable diseases. But meanwhile, we are seeing a increasing trend of non-communicable diseases becoming more prevalent, and they are, maybe I can say, they are new epidemics of the world. So we need to, as a healthcare experts, doctors, and innovators into the healthcare, we need to somehow provide quality healthcare to the last corner of that earth, which are untouched by any kind of medical facilities. So there are many such rural areas in the world, and they are devoid of even basic medical care available to number of people. So still today, there are many corners of the earth where people will carry a pregnant lady in a cot or a bed sheet, or a person who broke their leg into the bed sheet to the nearest healthcare facilities. And there are some other parts of the world, there are people who wait for that train to come and provide them the healthcare. That is the Philopepa train in South Africa. So healthcare access is a global challenge, not only with one country or two countries, even developed countries. That is what very surprising for me. Developed nations show a stark contrast as well. But what is the good thing I noticed is among all the developed countries, Austria has 182 patients per doctor. Per doctor, at least. That is good, I think. That is 5.48 per thousand population, whereas Australia has 251 and Canada has 357. Below the OECD's 281 average. OECD has set the average of 281. So while developing countries like India, we in India, it's facing around 1445 patients per one doctor. And in the rural areas, it soars to some thousands, around 11,000. So underdeveloped nations like Pakistan, Bangladesh struggle even more. So while researching on this doctors versus patients ratio and the scenario in the world, it is a bit surprising for me to see even the countries like US, UK still need to reach the OECD average. So for those viewers, I just want to share what is OECD. OECD is the average doctor to patient ratio. This refers to the average number of doctors per 1,000 people across the member countries of this OECD, that is Organization for Economic Cooperation and Development. So that's the reason I think innovators like you need to come forward to serve that last corner of the earth where healthcare is not reaching today, or those rural areas across the world need to get basic minimum healthcare. So that is saying that I would like to invite Dr. George Mathew and Guru Kora, who are the brains behind the Times Health app, which is a transformative telehealth platform, and they are intended to provide this app freely to the rural India, reflecting their commitment of giving back to the country, and which is a AI-powered healthcare access. So join me on Frontiers of Science, Medicine, and Innovation for the EMST podcast, episode 6. Join me on Frontiers of Science, Medicine, and Innovation for EMST podcast, episode 6. Telemedicine Bridging Healthcare Gaps. To learn how this app tackles disparities and offers a model for global health systems from Canada to Pakistan and US to Bangladesh. Welcome all to this episode. Let us start the conversation with the innovators who used AI to change the face of rural India's healthcare landscape with their promising Time Health app. So we will talk about in this episode how Dr. George and Dr. Guru came across and their journey as the healthcare innovators from the US, and what motivated them to build this social platform and give it back freely to the rural India, and what Times Health app can teach us about building scalable and compassionate technology for the healthcare area. So, Dr. George and Guru, this question is for both of you. Could you briefly share your respective journeys to our audience?
Yeah, absolutely. I'll go first, George, and then you can follow. Hi everyone. I'm Guru Kora. I'm the co-founder, one of the co-founders of Times Health. My background is in healthcare technology. I've spent last few years focused on solving one of the biggest challenges in global health. How to deliver high quality care where doctors aren't easily available. That's what led us to start Times Health. We are building Times Health, especially for the whole platform is to bring accessible, safe, and personalized care for people, especially rural areas and underserved areas.
And that's wonderful of you. Go ahead, Dr. George.
Thank you, Dr. Padma. I'm Dr. George Mathew. I'm a general internal medicine doctor. I've also been doing corporate work for about 25 years. It was during that journey that I had the privilege of meeting Dr. Padma. And later on, I also got to meet Guru, who has been a good friend and mentor, and now a co-founder of Times Health.
Wonderful. So, I want to get into the depths of the world's healthcare problem, especially related to the United Nations SDG 3, because all of us need to work towards SDG 3, though we are into different countries doing different kinds of work, but we are connected through the healthcare. So how do you see the SDG goal 3, and how do we ensure that healthy lives and promote well-being for one and all by 2030, which is nearing. We are into 2025. 2030 is almost 5 years from now. So from your perspective, what are the biggest gaps that still exist globally in achieving this? What do you think? What are those gaps still?
Go ahead, George.
So for those that may not be familiar, goal 3 is good health and well-being for most countries and for the citizens of those countries. And I do think it's a challenge because we do have limited resources, inflation in many cases, and honestly, a lack of understanding of current health status and how to address it. And again, the sources for that are many, but what Guru and I, as we look at the problem from both a clinical perspective and a healthcare technology perspective, we looked and tried to figure out a scalable way to address at least some of that, so we could ultimately push towards goal 3 of improving people's health and well-being by making a self-sufficient type application that would help people make better choices. Guru?
Yeah, I mean, I can completely concur with Dr. George here. There's a huge disparity with India's population, where 70% of India's population is in rural areas, and one of the main concerns is the ratio of doctors to the patients. I mean, 80% of doctors are in urban areas. It's really difficult to have access to care, and not just you take an example of someone who is pregnant in rural parts of Maharashtra, who cannot have, who cannot detect preeclampsia early enough that they can catch that, or someone who is in rural parts of Bihar, a teenager who is struggling with anxiety, and who can help, who doctors can help them. These kind of examples are all throughout India, and that access to care is what the 2030 goal should be and is, and we are going in the right direction, especially the core problems of chronic conditions, core problems of human health, especially got to do with mental health and things like that, where as we grow as a humanity, the challenges of, as Dr. Joss alluded, the inflation that leads to mental health issues and things like that, with not just with teenagers, with grown-ups as well. So the mission to solve that access and the cost of care is core to our problem in solving that by 2030.
So, do you believe and are you working towards somehow meeting that gap of 1400 per one doctor through Times Health app? Do you see your app will be able to bring that change? And if that is true, what is that percentage, like what is that number that you are targeting? Currently, there is a gap through our United Nations and World Economic Forum statistics say that there is rural India, there is a gap of around 11,000 to 11,000 of 11,000 people got one doctor. So how do you bring that down through the app?
Yeah, I think one of the greatest things about last a decade, the advancements in technology, especially in AI, has been remarkable, and we can use that AI and empower patients or users who everybody seems to have that smartphone in their pocket, and we can use and empower them by creating some sort of a health coach or a mental health coach or some AI which understands clinical information, understands which can do triage and which can help people, like that example that I gave you from Maharashtra or Bihar, and supporting that conversational in a language directly in their local language, and providing that AI doctor available 24/7 on their smartphone with zero cost almost, and then train those AI doctors in Indian clinical cases with safe and guideline-driven suggestions. I think that's what would make a really big impact. We might not be able to solve the entire problem altogether, but we'll be at least evolving into a position by 2030 at least to solve some of it. At least if not the whole thing, at least we'll be there halfway. George.
Wonderful.
Yeah.
Anything you want to add, Dr. George?
Yes, Guru, I think, said it perfectly. Where we're trying to build a bridge between many patients that are out there that may or may not need help at the time, but they know they have the confidence of having access to care to a certain level if they need it, or at least a tool that can help them figure out how serious it might be. But ultimately, the goal is to connect them to a live healthcare professional, a doctor, that can help them then manage or treat if they have something very serious, and make that relationship more efficient, but also create that connection. Because without more doctors to improve that ratio, the next best thing is creating tools that can enhance that doctor-patient relationship so that patients can self-identify, and then it can assist the doctor in triage so that their efforts are efficiently spread but they can still help people to the maximum.
When you say assist the doctor at the triage, can you give a use case?
I'm smiling because Guru was inspired by one of the first primary cases that actually helped him to really come up with the genesis of Times Health. Guru, I'm gonna let you give it because that's the case that started everything.
Right. I think the example that he really quote is my personal experience with my mom struggling with her chronic conditions in rural settings, with little access to specialized care. Watching her go through that entire medical system, giving me the first-hand insight on how bad the standard of care is, especially in the system level inequalities and things like that in India. I realize now that AI could fill that critical gaps, not just to replace that care, just to extend that care and make it available and make it equitable to those who are left behind either by geography or income or status. So, my mom's is a big inspiration. I know it's pretty corny to say that, but, that's what led me to one of the core reasons for us to work on this problem, population health problem.
Dr. Padma, when we initially talked about the case, Guru always described it as, what would I want for my mother to be taken care of properly if I'm not physically there? And by creating this large language model application and allowing it to be in the language she understood, the idea was that she could confer with it, self-identify if there was something of risk. If it was something that was benign or that could take time, it would help her self-identify, again, in her native language. But then if it ended up being something that was more and critical, give her information that when she went to go see a doctor, she could communicate it efficiently so that the doctor would then, it would be flagged for them. So they would know, oh, I understand now. I can build the history off of this and I can actually help the patient efficiently. So advancing the conversation beyond the typical intake to actually taking action to help the patient.
Yeah, I think a person able to interact with the a large language model in their own native language here is bringing the value, right? Because many in rural India cannot converse or type in English, but whereas they can converse with the LLM or any app in Telugu or Kannada or Tamil or Malayalam, any local language. So that is a differentiating factor even for your Time Health app, I believe. So because you both has your own personal things that might have inspired you into this journey and bringing this app together.
I believe so. Guru?
Yeah, absolutely. I mean, tech solutions are always there. It's not just the tech aspects of it, right? It's how we can empower patients to ask appropriate questions, ask proper questions that lead to faster solutions and things like that. So our ability to read or convey information or talk to them, interact with the patients in an effective way was the core of the problem. It's not the technology, what we are bringing to the people or how we are bringing to the people, or we want to take that technology to the remote areas of India. That's where the core problem was, and how we take that. And before us, we came here, most of the problem was solved by they already had these cell phones in their pocket. So we can utilize those cell phones appropriately, and we can use the power that's available in that cell phone can go a long way in solving most of these problems.
Dr. Padma, you and I have talked before about practicing while doing corporate work. And I think I may have mentioned my father had practiced as a cardiologist for almost 45 years. And I think one of the things he told me, he was technically very good. He always was up to date with the medicine, always was able to take the most technical aspects and explain to the patient. But to him, the most valuable thing was to make the patient comfortable and make sure they understand what was going on in their own language if possible. Because more than medicine, more than technology, it's the patient's well-being and how they feel, whether it's safe or comfortable, that'll help with the healing. If someone is feeling that they're under attack or they're not safe or they have other concerns, they can't focus on healing and getting better or taking care of themselves. And even speaking in someone's native tongue, the idea is to make people feel comfortable so they can give a full description so that the doctor can help or that the tool can help and help them understand what's going on so they can take better care of themselves. That, in essence, is what we're trying to do with Times Health.
Yeah, that brings additional that empowers patients basically, right? But we will ask these specific specific questions later. But could you walk us through the typical patient journey using your Times Health, and how does it address the key SDG goals, like indicators or goals or indicators like reducing the maternal mortality and improving chronic disease management, or access to having the skilled care access?
Let's see. I'll use a maternal example that Guru and I like to talk about, if that's okay.
Yeah.
We typically talk about how if you are a mother, and that can apply to rural India or rural United States or anywhere really, where a single mother with one or more children at 2 a.m, and they've found that their child is sick, has a temperature, and they're not sure what to do. In many cases, they would reach out to family or friends to ask for advice. They would see if they had medicine, and they would try to remember what they think would happen. But there is always that danger of what if they miss something or they misdiagnose something because they're not trained physicians. So in that case, the typical pathway, if you will, or glide path, would be, they would open up the application, they would put the information in terms of, age, sex, and then they would also describe the situation as best as possible. What would happen would be very similar to if you or I were to actually interview the mother. It would ask a series of questions to generate a differential diagnosis. And then based on the way those questions are answered, it would then cut that differential diagnosis down to basically those issues that are critical and could be life-threatening, those issues that are not as critical and can probably wait, and then those that are not critical at all. Very, very broad categories, yeah? And then the goal would be based on the information asked, depending on the condition and depending on what the input is, what is the best thing for the patient at the time? Many of the large language models that are being applied in healthcare now are not built for healthcare. They're built for data acquisition. The way that, and Guru would always share credit, but I have to give credit where credit's due. Guru designed this specifically so that it would be used for the patient. So if it goes beyond the parameters of what the LLM can safely handle, automatically it would instruct the patient to try to seek help. And that's something that would be different from most LLMs, where because of the way they're set, they would hallucinate an answer and give a response to the patient. And that answer could be wrong, but without training, how would the patient know? Once it's identified within what's within its parameters in those 3 buckets, it would then identify if the patient were at risk, it would again instruct them, you need to go seek help. If, on the other hand, based on the questions that are there, it would basically tell them, give them advice on what to do, things to try, and allow them to respond back as to whether it's working or not, or what is the next step. And in every one of those cases, Guru's designed it so that there's a safety net, if you will, that at any time if the patient feels doubt or concern, to then go seek help. But it would always try to keep the patient informed as to what's going on, explain its thinking, so that again, if and when they go to see the healthcare provider, they've already been through the line of questioning. as well as some of the differential diagnosis, so they can stop with some of the initial, meet and greet, if you will. They can get straight to the heart of it and get the care they need for their child.
It reduces the patient and physician interaction time, and physician also will be able to see more patients. So indirectly, that may also reduce the physician time, and the goal of SDG will be met, and OECD ratio of doctor to patient also might come down, especially for the when we talk about rural India, right? So when a patient is entering their patient or a person with specific health problems, they are entering a set of complaints into the app. It gives all the differential diagnosis, but uses basing on what parameters I have entered as a person or a patient, then it applies the deductive logic to deduce all those things, minuses everything which is not related to this initial set of uh, questions or complaints, and then gives whether is it very urgent for me as a patient to seek doctor's help, or do I have some time. And yeah, and also you are mentioning that it is not hallucinating your app like other LLMs. That is, I
Guru?
think, a very good thing that we see.
Guru, do you want to
Yeah.
explain a little bit of the science behind that?
Yeah, that's one of the core problems, right, Dr. Roy? In healthcare, you don't want your artificial intelligence, the core model, to actually predict something and say something that's not true. So usually the way artificial intelligence, computers or systems are built is something called hallucination, where it says if it's not able to find the right answer, it will choose the closest answer. But in healthcare, that's not acceptable. We don't want the closest answer. We always want the right answer 100% of the time. So one of the things that we do in collaboration with Harvard Medical School and Department of Energy Oak Ridge National Lab, which is one of the premier energy institution here in the labs owned by Office of Science here in the United States. In collaboration with them, we ran and designed a model in such a way that these hallucinations or the predictions become completely zero. So if the AI is not able to come up with a problem, it will straight away and tell you that you need it will outsource that particular question to an actual physical doctor or a telehealth person, rather than going and giving you the nearest closest solution, which we call as hallucination. It might work in some other field, but not in healthcare. That's how we were able to design something and train the AI in such a way that not to do certain things like that. And we took lots of measures for the technology to focus on not to predict anything that's not there.
Yeah.
Dr. Padma, I also wanted to mention something in the way Guru designed our LLM, again, specifically with a healthcare basis. When you look at general large language models, what they're finding now from a cybersecurity perspective is that there's an exploitative weakness where, because the models that are traditionally out there learn from inputs that are given by the user, people are able to put in fake data as well. So if you can imagine, there are those that are now testing out putting in fake information to healthcare-based LLMs about fake diagnoses, fake treatments, and unfortunately, without some way to filter it or assess it, the LLM in those designs takes in that information and adds it to its data set, which will then spread like misinformation.
True. It's like a virus.
A mind virus.
Yeah.
And without, again, as we said before, if the person on the other end, the user, is not trained in medicine or healthcare, they may not know the difference. Or worse, they may actually end up taking an action that would be harmful to them. The way Guru's designed this, it does not take the user input and use it to train itself. It does assess it, and it does try to give an honest answer. But the way Guru's designed it, if it doesn't match up with the data set that's there, it will say that it's beyond its reach and advise the user to seek a human doctor to clarify and hopefully verify what's going on.
So what are those qualifiers that you have added in the app that identifies a real person or a fake data set is being entered?
Oh, we should talk about the privacy by design. It's not in the LLM itself. It's how the LLM is deployed, Dr. Padma. Guru, is that, I feel like I'm talking out of my space when I say that.
No, absolutely. You're right. Absolutely, George. The example that I gave is a classic one where women's health, there are lots of things that you want to discuss with a doctor, which you want to keep it confidential. You don't want it out there on the internet. And especially if you don't want to keep it even with the doctor, you want to keep it in your device. That's exactly the core area. Trust, right? Doctors are known for trust. You need to have that trust, and we need to generate that trust with the AI itself. So in order to solve the trust, it was the two-phase problem. One is the hallucination, cut down the hallucination, and another one is how can I protect users' data? And the core problem that everybody else seems to take is, let's put it in an enclosed way on the cloud or in a storage unit out there, but on the internet. But it's still not 100% secure. So what the problem the approach we took is not to keep this anywhere but inside your device itself. So the conversations that you're having with your AI, all those conversations are stored on your device. They never leave your device. So if you delete the app and the conversation goes away. So it's intentionally designed that way so that you are completely, that trust is available with you all the time. And the AI is making sure that even the app developers or developers of the company behind this, people who are behind Times Health, also don't have access to what you are talking to the AI.
Okay. So yeah, that's a really good thing. And how are you ensuring the quality when it comes safety aspect we spoke, but quality and also the continuity of care? How are you ensuring when we talk about the digital first model like Times Health?
Right. So when we design this, there are different quality metrics that's a standard of care. Especially here, there are a couple of institutions here, University of Michigan, and then Urbana-Champaign, as well as Harvard Business School, have outlined some sort of a metrics where you can define what the quality of responses should be and how those quality of the responses measure with the actual data set that they have curated, that you can compare the results that your AI is generating compared to the actual doctors who have a certain experience in the field answer. So you compare them, and then you try to measure what level of confidence that you have in the AI that matches the actual doctor. And there are lots of data sets, lots of data and metrics available, metrics in clinical care, metrics in medication guidelines, metrics in specialty, subspecialty like ophthalmology or optometry or even mental health. And what we did was we compared our model once we created it with what OpenAI is doing and what Google is doing. And then we compared ourselves with various different categories of these metrics and made sure that we at least are as good as Google's model or OpenAI's model. And since our model is specifically tuned towards medical guidelines and medical has some algorithms that actually run for clinical guidelines and healthcare, we are way above the generic AI models out there in the market.
Yeah.
So, there are many telemedicine or this kind of apps solutions might exist. So what makes Times Health unique, especially in its potential to scale across diverse geographies? When we are talking about Times Health, you are not only focused in providing a service to rural India. So when we talk about SDG Goal 3, we want to provide, we want the healthcare, this kind of applications to reach that dark corners of the earth where there are no doctors.
Right. So one of the things that we wanted to do right from the beginning is how do we make that reach? How do we make that presence at a distance possible? In rural areas, it's not the technology innovation that actually reach, it's actually reaching the technology where the people are. So one of the things that cornerstone for doing is this: let's have an interface, this conversational interface in the local language itself, in Hindi, in Telugu, in Tamil, and various local languages tailored to the dialects or spoken style. And that solves you some of the problems that you are facing in terms of how I can interact. Either I can interact by typing or interacting directly with spoken as a in your language and your dialect. And there are lots of power outages in India, sporadic access to wireless connection and things like that. So offline mode was really important for us, where even if you don't have internet connection, you can still provide the key features and follow-ups and things like that without signal. So we wanted to make sure that this mode is available, where even if you are in some rural parts of India where the cell phone service is not available, then you can still talk to the AI, get answers from the AI, get safe solutions from the AI. And it has to be device completely agnostic. What that means is anybody can run with any type of device. Maybe it's some sort of a phone, it's a working phone is all the requirements are. Other than that, it's available. And also the app is designed in such a way, Dr. Roy, is it acts as a health coach for your daily wellness. So for example, the example I gave you from Bihar, who is diabetic, this patient who is diabetic, who wants to maintain their chronic condition, but don't know what to do on a daily basis, what to eat, when to eat, and what type of exercises they need to do. And then that daily wellness check, which acts as a health coach, will also solve some of the problems. So we created these targeted goals and set out to achieve them.
Okay. Yeah, that's very interesting when you talked about even without having internet access, one can interact with this LLM or the app. That is very interesting point, right? Yeah, you are absolutely right. Sometimes in India, power outages will be there, and even internet get affected at times. So those kind of times, no one should go unnoticed. No question should go unnoticed or unanswered. That is what this makes very interesting. So, are you tracking any health outcomes or indicators? For example, reduced out-of-pocket expenses in case of US and faster diagnosis. I think faster diagnosis already kind of you have answered, but I want to know reduced out-of-pocket expenses for people across the world, especially US as well.
Typically here in US, we have a little more granular data to actually answer you that particular question. Here in US, an average, a person between age 35 to 65 goes almost 5 times a year to a doctor. It can be either your primary care physician, your general GP, or your chronic condition subspecialty specialist. What we have noticed is there is a general trend towards using these health coaches and AI related apps. They are keeping you much more, they help you ask better questions. They help you get these questions or catch these issues ahead of time, where they don't turn into something where it requires some sort of an encounter with the doctor. So that way, even if you reduce one visit out of that
Yeah,
five, it's a
exactly.
big savings. It's a big
Yeah.
savings, not just for savings for the personal, your personal cost of care, but it'll just reduce the burden the healthcare system here in US is actually going through. It's a huge reduction, even if with that one savings, it's like close to 20% of the number of people who are going to the clinic, who are reducing, not going there.
Yeah, absolutely. So how are you planning to partner with various governments in the world, especially in India, NGOs or health systems to deepen Times Health contribution towards universal health coverage? Are you also planning to tie up with some of these startups, Make in India programs in India?
Right. So, I mean, one thing I wanted to make it clear is we are not here to replace the rural healthcare worker. We are trying to make their job easier and more impactful. So one of the things that we are thinking about doing is position Times Health as your clinical co-pilot, who actually works works with the India's frontline health workers, either supporting triage or supporting medication guidance, or even just education, clinical education and healthcare education. And just having some sort of an interface, simple UI, contextual UI, empowering those non-technical health workers is one of the venues that we're trying to get into. And we are in talks with a couple of now state-run bureaucrats here in India to start a pilot within Karnataka, and see how it goes in some sort of a controlled pilot environment, where we can test out the viability and the validity of the solution itself, and then test the willingness of the users to solicit healthcare solutions from an AI. So there's various things that we are testing out, and it's a long, ardent task, but we are getting there.
Yeah. So have you deployed this already anywhere in the world, or you are yet to do that?
So we have deployed this here in US, but it's available in the App Store in India. We have just started marketing this application, but in India it's completely free. Anybody can use it. They can just download it from the App Store, Apple App Store, or in the Android Play Store. They can directly download. It doesn't cost anything, and they don't share any data. We don't ask them to share any data. They can download it, use it directly on their cell phone.
Also, are you also? But one thing is, you are not replacing even the electronic medical records, which already are there in many hospitals in India or any other countries. For example, Epic or Cerner.
Right. The approach,
It could
Dr.
be
Roy,
an additional help or link with those apps.
right.
How
So
does that happen?
Right, Dr. Joy, the way it's positioned is not to replace the electronic medical record, which is a software that doctors use to store patient information. Instead, we are focusing on what we call as an edge device, which is much closer to the patients. The patients have their software rather than doctors have their software. So it's actually used for helping the patients rather than helping the doctors in terms of managing the patient care or quality of care at the patient side, at the doctor side. This software is used for empowering the patients. So there is no question of replacing any EMR.
Yeah. When I ask this question, it's not, I understand that it is not replacing, but how, for example, a patient interacts with the LLM, and when he or she goes to the doctor, they need to show it, or it directly, if they enter their patient identification number or patient registration number, does this information get into the physician system where he can see, okay, my patient had these problems? That's where the time of physician's decision would come down, right? So is that linking is happening right now, or it will happen in the future?
Right now, it doesn't happen, Dr. Roy. The reason being, it's usually these are control systems. These are systems that are have compliance associated with it. How you write, where you write, when you write, who is writing, all those kind of questions show up. So we don't want to wait till all those questions are solved at the bureaucratic level, at the health department level, and things like that. We would rather focus on helping the patient as much as possible. But as we evolve into using more systems on the ground, and then we start interconnecting all these systems from healthcare usage standpoint, which is an EMR, then patient-driven journey standpoint, which is this app kind of thing. So we will evolve in that stage, Dr.
Dr. Padma, just so I don't forget to mention it, the company that Guru and I met on, at least in the States, its number one goal was to use a privacy by design approach to pull information in through multiple interoperability rails and pull it together into the longitudinal record for the patient so they could identify gaps in care. So it's not a question of if, it's more of a question of when.
Yeah, exactly.
We're just starting out, but as we win more confidence with users as they're using in the field, the interoperability piece should be not only doable but successful, because again, Guru's done this, so he can do it again. Sorry, Guru, I have to embarrass you a little bit. Not only can we pull the information in, but then the AI or one of the agents can trawl through and then give a much more focused set of questions for the patient, and then also reflect over a concise bullet point list back to the doctor so they can focus on helping the patient right now.
Yeah, exactly, because this interoperability between systems is very, very important, and there are so many systems which are not talking to each other. Though they are on standalone, they are great, but unless until we bring this interoperability, for example, lab information to EHR, EMR, and this kind of patient system to EHR, that interoperability brings so much of comfort and ease, even for the ground healthcare workers, even the physicians, even a person who is operating in the operation theaters. For example, the LLM, the lab information system, sends some lab report immediately. That will be helpful for the operating doctor as well. So yeah, anyhow, you are onto that trajectory, which is very interesting to know. So both of you are based in United States, but you have very good noble thought of giving back to your country, that is our country, India, and through this initiative, right? And how has your global exposure influencing, and also um, that is helping you to build this as a healthcare and bring that healthcare equity across?
Guru, may I?
Please.
When you mentioned the OECD goals, what we're finding more and more, despite anything, is the fact that the problems one country has are the problems that all countries have. And we're all starting to realize that, whether you look at it as developing or developed, there are people in all countries that are having trouble, in this case, accessing the care they need to get health and wellness. So in some ways, and this is going back a ways, there was an old principle by a Harvard Business School professor, C.K. Prahalad, actually I think it was University of Michigan, where he was talking about bottom of the pyramid innovations that work in one country can be reverse engineered and built to work in another country. And I believe in a lot of ways that's what we're doing here, trying to take not only our loyalty to India, to our families, and learn from that, but also use that to help other people in other countries. Because what we learn from that experience, we bring back to the United States. We're looking at Europe. We're looking at other areas where there are people in need, and each one of those opportunities gives us a chance to make it better, so we can help more people.
Yeah, absolutely. Actually, we started looking more deep into this OECD ratio from the time the COVID times onwards. That's when I think world have realized somehow we need to improve this ratio of doctor to patient ratio. Unless until then, otherwise, what is the meaning of a developed country or not developed country when there is not much difference between these? And what advice would you give to the other healthcare professionals, may be doctors or health care technologists like us, and or startups who want to align their work with the United Nations Health SDGs?
Well, especially in rural India, Dr. Roy, innovation isn't about cutting edge. It's about meeting people where they are. Invite listeners, invite startups, invite people who actually make a difference in the future. So to imagine, so that there is no child never gets undiagnosed, or there is no someone who is in the village must travel 100 kilometers for a basic care. Those kind of things where the problem exists, where access to care is a big problem, where I think we can use our technology to increase that trust, empathy, and the presence at a distance by using innovations like AI, innovations like smartphone in everybody's pocket, and things like that. So I think taking, as George said, taking innovations that happen somewhere else to a place where that is most needed in rural India is what we want everybody to focus on, especially technology related startups.
So replicating that, so the innovation becomes faster as well and accessible to everyone.
That's right. That's right.
Dr. Padma, I'll have to say, and I'll use Guru as an example of kind of the right way to be. In many of the companies and startups that I've been privileged to kind of work with, there is always a natural tension between the technology and business side and the clinical side, because everyone has their experience and everyone's experience is valuable. But what I see more often than not, especially for younger companies, especially technologists that aren't, quite honestly, not like Guru, is that they tend to lean into what they know, and they don't think and assume the relationship in the doctor-patient relationship. The tool is supposed to help enable that, because, and I'll quote my father on this. One of the greatest privileges we can have is for someone to let us in so that we can help them. That's a huge amount of trust. And, as we allow for technology to be a tool to assess for that, that goes beyond just the doctor. That goes to the health technologist, that goes to the health business person. We're all being given a great responsibility and privilege to help this person that's asking for help. And I feel like it's a difficult thing to find for people to take that type of responsibility. They don't always have that mindset because they're not used to it. You and I, Dr. Padma, we've seen many people that go into medicine. It would be easy to make money any other way. You have to have a calling to do it. But like I said, I've been very fortunate to find a partner like Guru, who also feels that calling, though he's not been trained as a doctor. He understands it enough that he wants to build tools to assist with that. And that, to me, I think is the best way to kind of determine if you have a startup, or if you're going about it the right way.
Yeah, absolutely. That's what the cross-functional knowledge skill set will bring. If we are operating separately as a doctor, as a technologist, as a healthcare IT person, you may be great in your own field, but all the skills coming together this kind of innovation, like Times Health kind of innovation, can happen, which can help a large number of people across the world. That is what even our United Nations SDG 3 talks about. So, looking ahead 2030, where do you hope Times Health will be, and how will it have helped more uh, for needing the healthcare in that corner, the dark corner of the world?
Right. So I think one of the things that we are trying to do is that bridge that gap between regulation needed to capture certain aspects of healthcare and then the technology usage, and how do we navigate that particular especially that particular areas in places like India, where they are still evolving, rules are being framed, and some parts of healthcare where everybody can be accessed, where you can want to increase the quality of care by increasing the accessibility, interoperability, as well as reduce that cost of care. That kind of transparent environment where lots of things are moving parts, lots of things are moving around right now, but we need to keep in mind, and us as Times Health, we will make sure that we will not stop for regulation to catch up, technology to catch up, and we will take the technology and to the place where there is a need for it, like rural India and underserved areas. I think that's what our goal here is, to be that transparent tech company, mandating plain language access to people who needs healthcare.
That's wonderful, and I wish both of you success in this endeavor. And also, I have confidence through this app of yours. The day is not very far where each person in the world will be able to will be able to get access to the healthcare. So, with that note, I would like you to walk our viewers through the Times Health app and what it is, how they can access, how they can download from the App Store or Google Play Store, and then start using it. So, over to you.
Dr. Wright, thank you so much for giving this platform to showcase this. Really appreciate it.
Guru, I told you she was amazing.
Yes.
The thing is, when right things people will do, right? So the outcomes also will be that everything will come together, and even nature will support you for your right causes. That is what happens.
Okay, so this app is available in US and in India. It's available in the App Store and on Apple App Store, as well as on Google Store, Play Store. Once you download and install it, you go through basic steps where it asks you a few questions. So now we are at the home screen, where you can ask any type of health-related queries that you have, just like you talk to your GP, and you can ask anything. Dr. George, Dr. Roy, do you have a typical case that you want to run here?
Dr. Roy, please.
You please go ahead.
Okay. Guru, let's walk through our typical case then, yeah? About the mom with a sick kid at home.
Right.
Okay. I'll start with, my son has a fever of 102 degrees Fahrenheit. Sorry, I should convert to Celsius. I'm not so good, Dr. Roy.
1 second. Let's restart this. This thing, George. The typical mom thing, right?
All right. So if it's the mom.
Let me start otherwise.
Oh yeah, please.
Yeah. So my son is having severe cold, cough, and I've checked temperature, which is around 103 degrees. My son is around 2 years of age. And I am worried.
as you can see, as Dr.
Yeah.
Roy narrated, she has a son, and the AI wants to get the complete context of the person that she's talking about, and it's asking a follow-up questions. What are the exact symptoms of cold and cough for his son is experiencing? Is it runny nose, wheezing, or difficulty breathing?
He's just having a runny nose, no wheezing or difficulty breathing.
Any signs of dehydration, such as wet diapers or dry mouth or sunken eyes? It's
Not
asking a
received.
follow-up.
Yeah, he's not received any other medicines apart from paracetamol.
He hasn't received anything other than
Other than
paracetamol.
paracetamol. Yeah.
What's his weight?
11 kgs. Liquid form. Yes, checked all.
It's saying that, considering that, it's asking you to go and check with the doctor.
Yeah, because yeah.
And I wanted to note the fact that it does try to put the references. So
Yes.
if there's a concern as to what the source is or if it's wrong, if they're thinking that they don't agree with it, they can click the link. It'll take them to the resource and they can review over it themselves. So that way, unlike some of the other resources out there, they'll know where it's coming from.
And also, it is linking with the American Association of Pediatrics, and also the CDC site,
Right.
which are good.
Right.
So, what if I'm asking, because I'm asking in English and it is so? What if I am the other native language speaker? Can you demonstrate that as well?
Right, definitely. So let's change the language. What you saw is these are all the languages it supports. So let's change it to Hindi, and then try that. In Hindi, I'm saying I have cough and fever. So it cannot just type. It can actually talk.
गुरु कोरा, आपकी उम्र 47 वर्ष है और आप पुरुष हैं। खांसी और बुखार जैसे लक्षण कई बीमारियों के कारण हो सकते हैं। क्या आपको सांस लेने में तकलीफ हो रही है?
हाँ, मुझे सांस लेने में बहुत तकलीफ हो रही है।
बुखार जैसे लक्षणों से पता चलता है कि आपको श्वसन संबंधी समस्या लेने में तकलीफ और खांसी के साथ बुखार जैसे लक्षणों से पता चलता है कि आपको श्वसन संबंधी समस्या हो सकती है। क्या आपको सिरदर्द या थकान भी हो रही है?
मुझे थकान नहीं, सरदर्द तो बहुत है।
गुरु कोरा सिर दर्द और सांस लेने में तकलीफ के साथ खांसी और बुखार जैसे लक्षणों से पता चलता है कि आपको वायरल संक्रमण या निमोनिया जैसी बीमारी हो सकती है। आपको तुरंत एक प्राथमिक देखभाल चिकित्सक से परामर्श करना चाहिए। कुछ सुझाव: अधिक आराम करें, पर्याप्त तरल पदार्थ पिए, स्वस्थ आहार लें। अधिक जानकारी के लिए आप विश्व स्वास्थ्य संगठन WHO की वेबसाइट पर जा सकते हैं https://www.who.in/। गुरु कोरा सिर दर्द
As you can see, you can actually have a complete localized conversation with the AI. You don't need to type if you don't want to. You can actually narrate it directly in your native language, in your dialect, and then it understands. So it has some of the South Indian and North Indian languages support, like Urdu. It has support for English, Kannada, Telugu, Gujarati, Tamil, Punjabi, and Telugu. It also has support for images. For example, let me show you in a different language where in Kannada.
So a skin lesion, let's say someone takes a picture of something they see on their wrist or their body.
ನನ್ನ ಕೈಯ ಮೇಲೆ ಏನೋ ಆಗ್ತಾ ಇದೆ, ನೀವು ಇದು ಇಮೇಜ್ ನೋಡಿ ಹೇಳ್ತೀರಾ ಏನಾಗ್ತಾ ಇದೆ ಅಂತ? I've just asked to the AI that that something is happening to my hand, on my hand, and then can you tell me what is going on? And you can see it actually gave you the complete results. It might be fungal infection or some sort of a dermatological issue. You can directly talk to
ನಿಮ್ಮ ಕೈಯ ಚಿತ್ರವನ್ನು ನಾನು ನೋಡಿದ್ದೇನೆ. ಚಿತ್ರದಲ್ಲಿ ನಿಮ್ಮ ಚರ್ಮದ ಮೇಲೆ 2 ಕೆಂಪು ವೃತ್ತಾಕಾರದ ಗುರುತುಗಳು ಕಂಡುಬರುತ್ತಿವೆ. ಇವುಗಳ ಅಂಚುಗಳಲ್ಲಿ ಪೊರೆಗಳು, ಸ್ಕೇಲಿಂಗ್ ಇರುವಂತೆ ತೋರುತ್ತಿದೆ.
As you can see, you can have that conversation directly using some sort of an image. So it's pretty easy for you to actually take a picture of your problem with your mouth, or something in your eye, or something with your skin, or even a picture of an X-ray. You can actually take that and ask the AI to give you a suggestion what is going on, why it's happening to me, or even for educational purpose. Sometimes you don't know what exactly doctor has written in the note or the prescription that they have given you. You don't know exactly what you are taking those prescription for. So you can just take a photograph of that prescription and then upload it, and then ask the AI to educate you why you are taking, and what are the side effects of those and things like that. Especially if you don't have if the doctors don't have time to explain it to you exactly what the side effects might be and things like that. So this can be an extremely good educator for you.
Really interesting and wonderful. I believe this will be a great addition as a patient tool, and this will definitely empower patients across the world. And I wish you both all the best in this journey, and hope to see Times Health app is changing the face of telehealth very soon.
Thank you.
All the best to you, both of you.
Thank you, Dr. Roy.
Have a wonderful rest of the day.